Because discharge really should start at admission, sometimes that can be several days before a patient discharges, and they get a lot of information and education. So we needed one designated place to keep all that information so that it goes home with the patient. And through the creation of the discharge folder, it allows for just that. And all the information is stored separately in specific tabs to make it easy to refer to. And so while the patient is here, we'll be using the discharge folders to start education on discharge, medication, treatment, follow-up throughout the whole continuum of care.
With the discharge folder, we will be able to maintain patient information, patient education, and anything else that will benefit the patient on their road to recovery. With the discharge folder, their health information will be organized. They can use this information not only here in the hospital as they transition to home, and also the ability to carry medical information, clinical information to their healthcare providers outside. This is a great opportunity for us to provide excellent patient experience, also health information, and help the patient on their road to recovery.
The pilot really came about through work from all of our inpatient areas, collaborating to determine what would best meet the needs of our patients. Those who are intimately involved in the creation and development of the folder include, of course, our physician colleagues, our case management team, our inpatient folks, and together came up with some really wonderful steps to improve what we're doing ultimately for our patients. Ultimately, we want to reduce readmission rates. We want to improve the engagement of our patients and, of course, with our nurses, and ultimately improve the safety of all of our patients.
The interdisciplinary healthcare team will use this folder upon admission, throughout the patient's stay, and upon discharge for effective communication. Key aspects to this folder was created in an organized and clear, concise format. In the first tab, in My Hospital Stay, the nurses will be inserting information given by the healthcare personnel that are pertinent to the patient, including consultant cards from physicians. In the My Medications tab, nurses and pharmacists can provide patients with medication education on side effects and include a hard copy in here. In the My Health Education tab, the interdisciplinary team will be providing information on diagnoses, procedures, and exams, and providing a hard copy for patients to reference. In the My Regulatory Information tab, the case managers and social workers will be providing important information on patient rights. In the My Discharge Instructions tab, nurses will be providing a hard copy of the patient's discharge instructions, including information on their follow-up care, medication management, activity and diet to follow, and reasons to come back to the emergency room. We've also included an Other tab for patients to include any of their own personal information. Another key aspect to this folder is the My Health booklet, which provides the patient with the ability to keep record of all the medications that they've been taking at home, including vaccination statuses, prescriber information, and information on their emergency contact information. Our goal is to effectively communicate to our patients on all aspects of their inpatient stay and ensure a safe transition for their follow-up care.